Hey, this is Jeremy, and today we're going to be talking about refusals. Now, a refusal is obtained whenever we come across a patient who does not wish to be transported, who is of sound mind and body and does have a decision-making capacity and is of the legal age. So essentially what this means is we have somebody who does present with a medical complaint or a traumatic complaint which still can affect their medical functions, and they do not want to go to the hospital by EMS. And that is something that they do have a right to do. Is they do not, just because we get called out does not mean that they're going to get transported. Now, whenever you are obtaining a refusal, you need to verify a few things. You need to verify that your patient is of legal age, and if they are not of legal age, are they emancipated or are they possibly in the armed services? And if that is the case, then they are going to be in that ability to consent due to their capacity in the armed services or their emancipation status. And if that is the case, they are going to be able to provide paperwork or documentation that is going to verify that. If you have, and you also need to verify their decision-making capacity. So, and part of looking at that decision-making capacity is what type of injury, what type of illness, what did you get called out there for? All right, could they potentially have a head injury? Do they have an altered mental status? If they're altered in any shape, form, or fashion, and they can't answer questions appropriately, or they're unaware of what's going on around them, then you may need to look into them not being able to refuse because that decision-making capacity could be hindered. You also need to look at their vital signs, which include unstable vitals. So if you have somebody with a glucose that is too high or too low, a blood pressure that is too low, a heart rate that is too high or too low, or an oxygen saturation that is too low, can that patient really refuse care if their vital signs are not within normal limits? Because technically those vital signs, they all go into maintaining somebody's mental status, and if they're altered, they cannot refuse because they do not have that decision-making capacity. Now, if you reasonably suspect that somebody is unable to refuse care due to a head injury, due to an altered mental status, due to their vital signs, you can always consult with medical control if your patient is adamant that they are not going to go. And you can also consult with your protocols, because your protocols may provide some insight into this. Maybe you do have a right to chemically, physically restrain your patient. Maybe you need to call medical control and allow your patient to talk to the physician, your medical director or physician of the hospital. And then at that point, it is all up to the physician how we are going to proceed with this case. And that is the big part here, is if at any point you have a question and you're not able to answer it confidently, you can always consult medical control. And if your policy at your place of employment is to always contact medical control on any refusal, then in that case, you can always fall back on that. Now, whenever it comes to refusals, you need to let your patient know that you're there for them. And if they present with a complaint that you do believe is serious, let them know. But if they present with something and you say, hey, you're not necessarily offering medical advice, but you're providing comfort, such as telling your patient that all their vital signs are within normal limits, their EKG is fine, these are the things that you're seeing, and in that case you can ease a lot of the patient's worries. And in that case the patient may decide, well, since you said everything is okay, I think that I'm just going to wait and I'm going to try to make an appointment with my doctor. And that is something that we do have the ability to do, is to advise patients of their vital signs and of their how we perceive their stability to be. But again, we need to document everything accordingly, and that is important. Is the documentation. If you see something, if you're doing anything, you must be able to provide the documentation to back it up. Now, if your patient does not want to go, never threaten your patient, because that can lead to something that can be assault. Because assault is a threat. That's something that you do verbally. And then if you actually carry out that threat, such as restraining your patient or sedating or starting an IV or anything like that, at that point you're actually committing battery. And these are things that you need to consider whenever you're looking at these. Now, whenever it comes to documentation, you need to always document that what you saw. And so that includes the subjective and objective information. Subjective information is going to be what is spoken to you, or what is said to you, and that is not necessarily something that we can see. So if you have somebody that says my stomach hurts, well, you can tell me that your stomach hurts, but I cannot see that your stomach hurts unless you are physically curled up in a ball in pain, and you're presenting with that pain in your face and your vital signs that are all reflective of that. And that is going to be objective information. And those are things that you need to document in these refusals, and really in just any time that you come in contact with a patient and you're doing a patient care report. You do need to be documenting that information. Now, but you do need to be especially thorough, again, as refusals are some of the most commonly litigated calls that we're going to run. Now, you need to know and allow your patient to know that there potentially are alternative forms of transport if they do not wish to go with you and they do have that decision-making capacity. Their family can take them. They can go by cab. They can go by any other sort of transportation, should they not wish to go by ambulance, because there's some cases where we may get called out for a vital signs check to figure out if they can or if they need to go to the hospital. And if you believe that they need to go to the hospital, obviously let them know. And if they do not wish to pay or have their insurance or anything like that, have to pay for that ambulance bill, they can always go by themselves or have somebody take them. And that is an option that whenever you're obtaining a refusal, you need to make them aware of. And you do need to be sure to let them know that should you leave, that you can always return back and take them to the hospital again should they deem it necessary. Now, whenever you do this, you're also going to need to get a witness to sign. We would always prefer your witness be another member of EMS, such as, or any sort of public safety, such as the fire department, the police department, potentially your supervisor. And it can even be family, but what we do not want is we do not want your partner to be a witness for this refusal, because at that point it could potentially be a conflict of interest between you and your partner may vouch for you in situations where they shouldn't. And that is something that is incredibly important with refusals, is going to be that witness. Now, you need to make sure that something that you never do is falsify any documentation. So you need to factually document what you saw, what you heard, what was spoken to you, what you told your patient. Physical assessment wise, what did you find? Did you throw them on the 12 lead, on the cardiac monitor? What was their rhythm? Was their rate too fast, too slow? Did they present with any abnormalities? You need to document all of this in your refusal, because should something happen whenever you leave, the family or even the patient themselves may come back with a lawsuit that says, how could somebody of reasonable judgment and training have made a mistake and left me or my family member at home when I was sick and I ended up getting hurt, or there was some other repercussion because of you as the EMS provider leaving that patient at their residence or wherever it is. And that is where your documentation is going to come up. Your documentation is going to be what they reference in court whenever should you receive any form of litigation over this. Now, and so if you falsify any of that and it comes late, you look at it later to find out, or something occurs later and it's documented that, or pictures are taken or anything that contradicts your statements that you made in your PCR, that's throwing your ability to practice emergency medicine under your medical director. That's throwing that up into question, because how can you reasonably make those good judgments if you do not document it appropriately? Because the way that they look at it is your documentation is a direct reflection of your ability to provide care. And you can be an excellent paramedic but have poor documentation. And in that case, whenever anybody looks at your PCR, they're going to look at you as a poor paramedic or as a poor EMT. And if you do falsify something, and you do obtain a refusal, but it's uninformed, or your patient did lack that decision-making capacity, at that point you're looking at something called abandonment, which is where you have a unilateral termination of care that is not by the patient. Because a refusal is essentially, that's a termination of care it's patient initiated. Whenever we initiate that termination of care as a healthcare provider without follow-up care in place, at that point it's going to be considered abandonment, especially if we do not obtain a refusal. And these are all really important things that we need to understand when it comes to refusals. And you need to let your documentation be your friend and allow it to work for you, and develop a system to perform your assessments and to documenting your care. And that's going to be the best way that you provide yourself some consistency, and you provide yourself a reliable form of every time that you do a patient refusal, you do it exactly the same way. And that way, should you get called to court, you are familiar with the way that you write your reports. You're going to be able to rapidly look at it and say, this is what I saw, this is what I did, and your documentation is going to help you. And those are the really big things that we need to be worried about when it comes to refusals.